Hi, my name is Dr. Rebecca Ponder. Some people call me Sam Ponder. I'm an OB/GYN at Intermountain Medical Center in Murray, Utah. I went into medicine because I wanted to, cheesily enough, help people. And I always wanted to be a doctor, but I used to want to be a veterinarian until I was, I think, about 13 or 14. And my mother remembers me coming up and telling her that I couldn't really hurt an animal, so I was going to be a doctor instead. You know, oftentimes in the course of healing people, there is some discomfort or, you know, and with a human I can say you're going to feel a little bit of pressure, but with animals, you can't really reason with them. So that's how I decided to be a doctor. Well, I think obstetrics and gynecology is kind of the perfect mix of the clinical and the surgical. We get to see patients through their life, all these life changes, through amazing advances in their family life, in their contraceptive health, and then we also get to have the surgical aspect as well. So for someone who likes to have continuity of care but also surgical subspecialty, it's a perfect one. I think that, you know, having a young woman who's very nervous, has never been to the gynecologist before, come in for the first time, and being able to put her at ease and, you know, kind of shepherd her through this first stage in her contraceptive health and kind of into this, you know, adulthood of what it means to be an adult female. And for her to walk out and say, you know what, that really was a good experience and didn't scare me, and to come back the next year, I think that's very rewarding. But additionally, I think probably what I most enjoy about my job is the obstetrical aspects and being able to see a woman through a pregnancy and with a baby happy and healthy in her arms, and then see her back for the next one. Probably my most memorable moments in obstetrics are typically, you know, of course, in the delivery room. And I have some beautiful twin delivery patients who've just done, you know, had some very challenging pregnancies, very long for them, being seen frequently at the hospital and having potential complications and, you know, and some scary times during their pregnancy. And then to come, you know, finally to that point where they're able to deliver healthy, you know, mostly full-term babies. That's always a really encouraging moment. I do enjoy patients of all types. I love women who are from varied backgrounds, who are involved with their medical care and are interested in it. And I think it's fine to ask questions. I think it's good to ask questions and be interested and involved in your medical care. I also really enjoy taking care of women through kind of the earliest stages. I mean, we see young women even in their preteen to teenage years and then all the way through menopause. So I kind of like them all. That's why I'm in this field.